And then there is the case of the gentleman from Maryland who will join Congressman Weiner in the House of Representatives come January. Part of Republican Representative-elect Andy Harris's campaign platform was that he was foursquare against health care reform. Yesterday, during his freshman orientation, Harris threw a fit because he would have to wait to receive his government-subsidized health insurance. According to Politico, Harris, who's a doctor, was incredulous that he would be sworn in on January 3rd, but because of federal law, his government-subsidized health insurance wouldn't kick in until February. According to a congressional staffer who witnessed the blow-up, he stood up and asked the two ladies who were answering questions why it had to take so long, what he would do without 28 days of health care. Harris then asked if he could purchase insurance from the government to cover the gap. Buying health insurance from the government, especially when there's some sort of gap in your work insurance? Hey, Congressman-elect, you might be onto something here. You could call it the public option.
This is one place where I disagree with our congressman. He said public option was kind of a good idea. I think it was a terrible idea.
Except for him. Harris ousting Maryland's Frank Craneville on essentially a one-issue campaign anti-health care reform, insisting there was nothing that authorized the government to be involved in it. But back to the important issue, his health care and his hissy fit because he's not getting it fast enough. This is the only employer I've ever worked for where you don't get coverage the first day you're employed, he also reportedly said, which must be very troubling for the people in his district who don't get any coverage any days that they're employed. Let's turn to Slate political reporter, MSNBC contributor Dave Weigel. Good evening, Dave.
Good evening.
Is this enough of a microcosm? I mean, government health care is evil. I want my government health care right now. Is it enough of a Tea Party microcosm to put up a statue of Congressman-elect Harris? And if so, how tall?
Well, whoever leaked this to Glenn Thrush of Politico knew what they were doing.
Yeah.
This was a live grenade coming at a Republican who some Republicans were hopeful would become a credible spokesman on health care. And he's tried to spin this. I mean, his latest spin, which he told a Baltimore station tonight, was that he was making a point about how ironic it is that everyone's required to buy health care because of this health care law, but the government employees don't have it for a month, which doesn't really rebut the reason why people are angry. No, but Republicans like to put up these guys who have experience in the medical field as spokesmen on this, and he canceled an interview with the Baltimore Sun that he had scheduled. He's dialed this back because it really did seem to everyone who wasn't there, which is all of us, like a tantrum that was a hypocritical tantrum.
The thankfulness that Harris should actually be expressing in here, a statistic from the Kaiser Family Foundation, it did an annual survey of employer-provided health benefits. 74% of covered workers face a waiting period before coverage is available. The average waiting period is 2.2 months. So he's actually coming out pretty well in that part of the equation. Do we know, are there any Tea Partiers who have really put their health insurance where their mouths were during the campaign? Has anybody refused? Did anybody stand up at this meeting and go, this doesn't apply to me because I have to have principles because I said there's no government health care, I'm not going to take this?
Well, no, not really. I mean, Congressman Weiner was making good points earlier that this wasn't really vetted in every single campaign. It was what they were running on was so anti-Obama policy, so pro-repeal, that they didn't really go much further in explaining this. And they're going to try and dismiss this as a gotcha, which it feels like definitely somebody knew they were nailing him on this. But this is the problem that a lot of Democrats see with the incoming Republicans. They don't really tie their theory of policy to the way this stuff works. And they claim Democrats don't, but look at unemployment benefits. It's considered a punchline to Republicans that extending unemployment benefits will do anything but make somebody a permanent serf of the state who just lives off government benefits. And we know that that's not something that people who have been in a tough time for 6 or 7 months and who need that money believe. In terms of what they want to do on, or what they said we should have done on TARP or things like that, they say everything would have worked out great if we just let the banks collapse. And they're against foreclosure, things like that. I mean, they ran as populists, but a certain kind of populists. They just said all these problems are Obama's fault, and it's tougher to defend what they believe when real issues come up like this.
Is there any indication that, as you described, Dr.-elect Harris here, his reaction to the reaction to this, any suggestion that this has struck him? Because I was suddenly thinking of the scene from Citizen Kane where the corrupt politician says to Orson Welles, "I'd say this is going to be a lesson to you, but you're going to need more than one lesson. You're going to get more than one lesson." Does Congressman-elect Harris have any idea what this meant symbolically to people who have been fighting for health care or health care reform?
No, I think the lesson he's going to take from is that he shouldn't trust reporters, which
right.
Harris, some background, ran for Congress in 2008 and knocked off an incumbent, Wayne Gilchrist, who was more liberal. Gilchrist then endorsed Cradaville, the Democrat who held the seat. And I tell that because he was a proto-Tea Partier. He was one of the guys who ran, and with the back in the Club for Growth, actually, and said, if you compromise on anything, you don't deserve to be in politics. If you don't apply this, this very short litmus test on every issue and vote against things, then you are doing your country a disservice. So this is his first, he's going to have harder tests than this. Come January, when they start voting on taxes, when they vote on health care repeal, and when they vote on the debt ceiling, for example, they're going to test whether this stuff works. And so far, he's had some trouble explaining how this blanket policy works in practice.
He's going to need more than one lesson, and he's going to get more than one lesson. MSNBC contributor Dave Weigel, as always. Thank you, Dave.
Thank you. Good to see you, Keith.